Hello, everyone. Take my facial covering off. Hi there, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here with you on Facebook Live on Friday, April 9th. Just to give you an update on the impact of the COVID-19 pandemic on Mobile County and talk a little bit about our vaccination efforts and some changes to our statewide Safer at Home order. So today worldwide, we're looking at over 134 million cases of COVID-19 with nearly 3 million deaths, 2,907,000 deaths. In Alabama, we're at about 518,000 cases of COVID-19 with just under 11,000 deaths. And in the daily report that came on a little bit later today than normal, is reporting an addition of 25 cases of COVID-19 reported yesterday. That brought our total to 37,778. Sorry, a little tongue-tied today. So if you look at the cases reported daily this week, we had a larger number on Tuesday due to a reporting lag, but we're averaging, anywhere from 10 to 30 cases a day or so. One additional death was reported to us yesterday, bringing our total to 799, and 8 more people were hospitalized with COVID-19 in Mobile County hospitals, bringing our cumulative number of people hospitalized with COVID-19 to 4,849. And then the number of people hospitalized on any given day with COVID-19 in our mobile hospitals yesterday sat at 19. So again, it's running a little bit higher than it was last week, but nothing to be too alarmed at yet. We've been seeing on the national news that many states are seeing another increase in the number of cases reported, and it's sort of looking like their fourth wave is beginning. And some national reports compared those Midwestern and Northeastern states as, their numbers are going up and ours are still going down, and attributing it maybe to some false data with regard to testing. But when I look at our data, we are meeting our federal testing goals. We have been meeting those goals for probably going on, 10, 11 months now, since back in the summer. And yes, the number of tests are going down. Our percent positive is much lower, but we are still meeting our testing goals. So we will continue to keep a close eye on that. What I attribute this to is that, when COVID was first announced in the United States, in the upper Midwest and in New York, it was, a month or two before we saw our first cases in Alabama. So we have sort of lagged behind the rest of the country. So I think what's happening is that we are now at our lowest since pre-COVID times, and we're keeping a close eye to see if we too will begin to see an increase in the number of cases reported because of things like lifting of masks orders, holidays, Easter, spring break, gatherings, restrictions on gatherings that have been put into place. So we're just going to have to keep our eye on things and see how things go. So to talk about a little bit more about the Safer at Home order, so as many of you probably are aware, the current Safer at Home order, which expired, I believe, today at 5 o'clock today. So it expires at 5 o'clock today, and the new Safer Apart state order by the governor and the state health officer will go into effect today at 5 o'clock and will last through May 5th at 5 o'clock. And let me just tell you of some of the changes. Most of these are a lifting of any requirements with very few exceptions. So for individuals, you are encouraged to maintain 6 feet apart, wear a mask, stay at home if you're sick, wash your hands, refrain from touching your face, sneezing in a cough into a tissue or into your elbow, and disinfect frequently frequently used or touched surfaces. Woo, it's been a day. For quarantine for infected persons is still mandatory. So any person who tests positive for COVID-19 shall be quarantined. That it has not changed. You still have to stay at home if you have been diagnosed with COVID-19 through a laboratory test, or if you've been exposed to someone who had COVID and then you develop symptoms. Okay. Protections for employees. So employers are encouraged to take steps to protect their workers by wearing masks and maintaining distance and disinfecting and hand washing and staying at home if you're sick. So operators of businesses, government offices, educational institutions, and other establishments, can still remain open to the public, and they are encouraged to encourage the use of masks and facial coverings, maintaining 6 feet, and disinfection. And then also on April 9th, this is a little bit of a change for facilities that serve children. So again, they are encouraged to apply with all of those public health measures that I mentioned previously and maintain a 3 feet barrier of separation between children from different households. So that is when children of different households are in an educational setting. They can be within just 3 feet apart to be able to accommodate more children back in-person learning, in-person activities, that sort of thing. If the children are between the ages of 6 and 18, facilities serving children under the age of 6 need not take steps to maintain separation between these children. Then the information for hospitals on gatherings and that sort of thing have not changed. So a little bit of information about this safer apart order. So with the health department, we still very strongly recommend and encourage the use of facial coverings when you're in public, maintaining physical distance, washing your hands, disinfecting high-touch areas. It's really important. We have really safe and effective vaccines, but they're not 100% perfect. So we may have COVID cases that among people who are vaccinated and think that they are protected from asymptomatic or symptomatic COVID disease. We have variants that are emerging, and we always want to be cautious about whether or not new variants could emerge that are able to evade the immune response that is mounted in response to natural infection or immunity from a vaccine. So again, just lots of reasons to continue wearing a mask when you're outside of your household, particularly if you're at a gathering, and maintain distance from people who don't live in your home. All right, we often talk about complaints on Friday, how many complaints we've gotten. We didn't get any through our main line, but I just wanted last week. But our community liaison team that does a lot of callings in the month of March, this is led by my colleague Monica, and in March, she reported to us that she had 53 consultations, handled 21 complaints, and talked to 5 locations about potential outbreaks. And I'm just looking down through this list from her report, and it's everything from elementary schools, football teams, barbecue restaurants, urgent care centers, coffee shops, skating rinks, pharmacies, hair salons, and government agency. I mean, I've got 3 pages of these things. So we still are seeing a lot of COVID around the community and heightened concern about COVID in the community. Daycares, preparatory schools, corporate offices, big box locations, just all kinds of examples where people are seeking our advice about their concerns over COVID, or where we have gotten a complaint or a report that a location is not doing all that they can do to protect members of the public and protect their employees for COVID. All right, couple of questions, and then I'll talk a little bit about vaccine. So, several folks asking if Mobile's mask mandate is going to remain in place after the governor expires today at 5. And you might have seen in the news that the Birmingham City Council and the Montgomery City Council both voted to extend the mandate for wearing mask coverings, wearing a mask in those locations for another month or two. I've not seen anything come out of the Mobile City Council. Again, we are the health department, and our public health and healthcare colleagues around the county are strongly recommending that everyone continue to wear your face mask and socially distance. Someone from the media also asking about the NBC Today Show report saying that Alabama's COVID testing rate may be giving a false sense of security. I think I addressed that we are meeting our testing goals, and the steady decline that we have seen and we continue to observe, record low levels since we began seeing COVID-19 cases. We're just keeping a very close eye on things to see if we have a fourth spike or increase or wave of cases related to Easter holiday and spring break activities. Some other questions that came in. Can I touch on booster possibilities for the Africa variant? So the vaccines right now are effective against the variants, though not as effective against the African and South African strain. And I have not heard of any certainties about a booster shot to protect people who are fully vaccinated now. I've heard no certain information about whether or not a booster is going to be needed, let's say in the fall, something of that nature. I'm sure we will over the coming months. Let's see, someone saying that we had a booster vaccination event at the cruise terminal. I think that was Wednesday. It was on Wednesday. And if you've been to the cruise terminal, you know that there's a train track that goes right across the entrance to the cruise terminal. And I think a train sat on that track for 2 or 3 hours on Wednesday, and many people had to wait a long time or come back. And we weren't able to get to vaccinate everybody that we had hoped. And so, yes, we likely will have a makeup event, but I don't know the details about that. So please stay tuned to mchdcares.com or call us at 410-MCHD. It's 251-410-MCHD to learn about a makeup event. But remember, your second dose doesn't have to be right at 28 or 21 or 28 days. It can be weeks or potentially a few months after the date, and you will still get the full protection that you need from that second dose. So we will make opportunities for you to get that second dose. Let's see, someone asking if they got the J&J vaccine, if it's good for only 6 months, can they switch? Right now, all of the vaccines are, CDC is saying that we're looking at a 6-month definite protection. That's about as much as long as we've studied it. So I expect that as more and more people are vaccinated and those months and times start ticking along, we hope that CDC will be able to extend the effectiveness of those vaccines beyond 6 months. Remember, we didn't start vaccinating people until December. Yes, there were, tens of thousands of people that were included in the clinical trial, but they too are, less than a year out from their COVID vaccine. And so I think CDC wants to collect information, real world information on the length, duration, and strength of the immunity that comes with vaccination. So it's looking really good so far. So go out there and get vaccinated. All right. So some other questions that were submitted on our mchdcares.com website. Someone said they received their first dose in Huntsville and they're coming to Mobile on business. Will they be able to receive the second dose here? And the answer to that is no. You must return to the location and the provider of your first dose in order to get that second dose. Someone saying they recently moved to the city and need their second dose. Would they be able to get it at Mchd? And that answer also is unlikely. That's a tough situation. So if you can, return to get your second dose, that is preferred. We are waiting on guidance from the state to see if they're going to make any accommodations for this type of situation. But right now, we are only vaccinating first and second dose for people that we give the first dose. And then someone else asking about second dose. So we try to, be very clear when we give you a card with your first dose to say, you have to come back here for your second dose in 28 days or 21 days if you're getting Pfizer. So for people that were vaccinated, that got their first dose in locations that weren't giving that message strongly, that's unfortunate. But right now, the health department is not in a position right now to assist you with that. If something changes, I will definitely let our public know. All right, on to vaccine events. So we're very happy to remind people that we have the Mobile County Health Department will be sponsoring a first dose Pfizer vaccine event at AIDT Eric Hine Learning Center on 4 2nd Street in Calvert. I believe that's in the north part of the county. All right, that is in conjunction with, I think, a steel plant there. AMNS, which is, I think the S stands for steel. So not anywhere close. It is. Okay. Okay. So the plant there is embedded in the community. They really want to, be a strong community partner for Calvert. And so they are opening their arms to anyone in the community that wants to come to the Eric Hine Learning Center at number 4 2nd Street in Calvert on Monday or Tuesday from 8 a.m. to 8 p.m. So this is open to anyone in the community. And please, if you live, within a short driving distance and you have not been vaccinated, please come see our staff on Monday or Tuesday from 8 a.m. to 8 p.m. in Calvert for your first dose of Pfizer. And remember, you'll need to return in 21 days to get that second dose. So think about that. And remember that Pfizer is authorized for people 16 and older. So if you are 16, 17, you can get get vaccinated at our location, at our vaccine events on Monday and Tuesday, and you do not need a parent to be with you to get vaccinated. So both of these events are first come, first serve, no appointment necessary, no cost to you. It's probably a good idea to bring an ID, but you won't need much else, just your patience and your willingness to get vaccinated to help protect you, your family, and your community from COVID-19. So that's it for today, unless we have any Facebook questions. I'm hearing that there are none, so have a great weekend. Stay safe, wear your mask, distance from people that don't live with you, and stay at home if you're sick. Be safe and get vaccinated as soon as you have an opportunity. Thanks, everyone.